What's up, guys? It's Dr. Kels coming to you live from Fit Club, Chelsea, Manhattan. Today, what we're going to go over is our Injured Reserve series. Odell Beckham Jr. just recently tore his ACL, and there's a lot of controversy out there because, especially in the sports world and the rehab world, he didn't tear it in the typical fashion in which we see ACLs being torn. So again, for those of you who don't know, your ACL is your anterior collateral ligament. It is one of the main ligaments in your knee. So the ACL is designed to limit the ability of your femur or your major bone in your upper leg from translating in front of your tibia or your lower bone in your leg, right? So the ACL prevents this from moving forward on top of this bone. So when you see Odell Beckham chasing the defender down, his leg he stutters here. So this is where the tear happened for Odell Beckham. He was running full speed ahead, tried to slow down, and the ligament was so weak that this bone moved forward rapidly over that lower bone, or his femur moved rapidly over his tibia, and he actually sustained that tear. Again, from watching the play, you wouldn't think that a serious injury occurred. However, we now know that he tore his ACL and he's out for the season. So what I really want to educate you guys on is some proper movement mechanics to try to reduce that from happening for youth athletes. So what we want to really go through with you guys today is some movement training and mechanics, so hopefully we can prevent you from sustaining a torn ACL. First move we're going to be doing is going to set up two different cones, and we're going to work on deceleration. Essentially what we want to do is be able to control your body decelerating before either a tackle or before a layup in basketball. What's very important is that your body weight isn't continuing to translate forward as you decelerate and stop prior to hitting that cone. Another thing that's very important with this drill is that your knee mechanics, you should have your hip aligned over your knee, aligned over your second toe. It is very important that we try to keep those mechanics spot on so that we don't put any bad forces at your knee. So exercise number 2 is going to be a landing drill. We're going to start by standing on a 24-inch box and stepping off and landing with both feet nice and firm on the ground. As we go through this drill, I want you to think about your body as almost like a spring. When you land, you want to have a nice soft bend in your ankles, a nice soft bend in your knees, as well as a nice soft bend in your hips. That's very important. When you land on a stiff knee or a stiff lower extremity, there's a lot of shock that goes through the body. And again, we want to prevent that hyperextension moment at your knees, which puts your ACL in particular at risk. Our third movement-based drill is we're going to combine some lateral motion as well as some forward and back motion as well. So we're going lateral slide, side to side, really trying to prevent that downward caving in of the knee. This force here is a really bad force in your knee, and that can predispose you to injuries, in particular to the ACL. So as we move sideways to sideways, again, we want to think about hip over knee over second toe. Once we get back to that middle cone, we want to sprint forward, really stop without that body weight looking to come forward in a controlled manner, push backwards, and continue to go through the drill, right? So we're challenging our knee in two planes of motion here, in the sagittal plane and as well as that frontal plane. So those are 3 movement-based drills that we teach our athletes as our prehab programs to try to prevent ACL tears from happening in the first place. If you guys love this content and you want to learn more, please subscribe to our YouTube channel and like this video. We're going to be shooting a ton of videos with regards to trending topics and sports-related injuries. Again, my name is Dr. Kels. Until next time, peace.